Now, if we can demonstrate in an 8-week outpatient treatment for a tenth of that price, better outcomes, then not only is this the right moral, ethical, and clinical thing to do, it's the right financial thing to do.
Hey everyone, welcome to the Traded Black podcast. I am your host, Shad Dales, talking psychedelics this morning, and a great guest that we're bringing in. He was actually on our podcast about 6 months ago during the hype of How to Change Your Mind, the big Netflix documentary. Dr. Ben Sessa, who's the co-founder and head of psychedelic medicine at Awakn Life Sciences, which trades on the NEO under the ticker symbol AWKN, and on the OTC under the ticker symbol AWKNF. Good day, Dr. Sessa. It's great to have you back on. How are things?
Hello, Shad. Good to be here. Good to be representing Awakn. Good to get the coverage from your wonderful channel and the networking that you provide. I'm here to talk medicine and psychedelics and the future of the psychedelic renaissance with you.
Appreciate the kind words. Lead financial writer Benjamin A. Smith joins us once again. Ben, good to see you, sir.
Great to be here. Looking forward for the discussion on ketamine-related things. I'd like to know more about all these issues myself from the expert, Dr. Ben Sessa. So let's do this.
Good to see you, Ben.
First thing I wanted to bring up is this How to Change Your Mind Netflix documentary that came out 6 months ago really did a lot for the industry. You were featured in the MDMA portion of the actual documentary itself. Have you noticed any change, any uptick, any awareness as far as you, your name, your company, and most importantly, just the overall better understanding for the industry since that film has come out?
Yeah, absolutely. It's interesting. I was actually with Michael Pollan in Iceland 2 weeks ago at a conference. We were doing a conference together, and I put my hand up during his Q&A and I said, Michael, your book and film was really annoying because it was so successful. And there's those of us who've been working in this industry for 15, 20 years, making as much noise as we can. You put that out and the whole world suddenly sits up and takes notice. So no, I mean, he's a good friend. You know, we all had a laugh about it. But no, it's quite amazing. And I think the main reason being that Michael he's not a psychedelic psychonaut person. He's a mainstream US personality celebrity who's well known for straight stuff. So when he then says psychedelics are worth looking at, suddenly it opens it up to this huge population of people who are prepared to listen, which is great. As I said, kind of frustrating as a scientist in the field because I've been saying the same thing for 15, 20 years. But it's been amazing. And, you know, the phone's rung off the hook continuously since then in terms of referrals to our clinic. I think one of the frustrating things about it was that it focused on psilocybin, LSD, MDMA and mescaline, none of which are yet licensed medicines. So people are wanting those, whereas actually ketamine is the only licensed psychedelic medicine.
Good point.
It set the path forward to bring this into the mainstream in a fabulous way. And we've got to capitalize on this, keep this subject in the front rooms of people and in the front of their minds, because this really is going to be the next big force in psychiatry.
Hey, Dr. Sessa, can I stop you there and ask a question? Just because you brought up the other compounds that were in How to Change Your Mind, and I think part of that is the reason for that is because a lot of people, there's a debate in the psychedelic community of whether ketamine is actually a psychedelic, because of course it has those dissociative effects, but some people sort of don't classify it with the psilocybin, LSD, and so forth. So in your opinion, is ketamine, should it be considered a psychedelic medicine or something different?
Yeah, so it's a good question, Ben. I think the taxonomy of psychedelics is an interesting subject. If you're going to be really purist about it, you would use the word psychedelic with a capital P to refer to what we call the tryptamine or serotonergic psychedelics, LSD, psilocybin, DMT, and mescaline. But I would say that if we define psychedelic as a drug which enhances psychotherapy by allowing access to repressed memories and feelings through an altered state of consciousness, that opens the door to many other compounds. That includes MDMA, it certainly includes ketamine, even includes THC. You know, trust me, take pure THC with no balancing CBD and tell me that's not psychedelic. And then there's things like ibogaine, salvia. These are clearly psychedelic in their effects, but they're not in that group of what we might call serotonergic psychedelics. So we sometimes call that group, the LSD, psilocybin, DMT, classic psychedelics. But I would call them all psychedelics if you think of them as agents that enhance psychotherapy and cause an altered state of consciousness. So ketamine, absolutely. I mean, we give ketamine to people at high dose. Trust me, they have a psychedelic experience.
Wow. Are you seeing, because I'm noticing over here in the U.S., ketamine clinics popping up everywhere. Are you seeing the same thing in the U.K. or anticipate to see the same thing in the U.K. here in the short term?
It's a good question. So there are indeed about 600 or 700 so-called ketamine infusion clinics in the United States and Canada. You know, many of these clinics. Now, what the vast majority, I think 95% of them are doing, is they're infusing intravenous ketamine as a treatment for depression. And ketamine works really well as a rapid-acting antidepressant. Within a couple of hours, your mood improves. It stays better for about a week, 10 days, and then you need another shot, another booster to keep it going. So it's a good rapid-acting antidepressant with no psychotherapy added. You don't need to.
But is it highly addictive if you're doing only a week to 10 days?
It's not highly addictive. Ketamine certainly has addictive properties, but even amongst heavy recreational users, addiction is relatively low from a clinical perspective. It certainly can be addictive if you use it very frequently.
Why is it relatively low?
Why is it relatively low? Well, that's just what we see epidemiologically. There's a lot of recreational users that may use quite heavily but don't have the typical features of addiction. I think the really important distinction to make, Shad, is that at Awakn clinics, we don't ever give ketamine without psychotherapy. We're not just a ketamine infusion clinic. We don't just give injections of ketamine then send the patient home. We use ketamine in the same way as we might use MDMA or psilocybin as a tool to enhance psychotherapy. So I'm a trained MDMA and psilocybin therapist, and I use ketamine in that same way. We work within the ketamine psychedelic space to enhance psychotherapy. So going back to your question, are there lots of these clinics in the UK? The answer is no at the moment. There's not. There's one other clinic or possibly two other clinics that use it as an antidepressant. We're the only clinic that use it with psychotherapy. We think that these clinics that just use it as an antidepressant without psychotherapy are missing a trick. There's a lot of value to be had in working in the psychedelic space. It also means we broaden the indications that we use it for. So we're not just using it to treat depression. In our clinics, we treat depression, anxiety, PTSD, eating disorders, and all addictions. So we're using it as an adjunct to psychotherapy for multiple indications.
What about the science of tolerance? You mentioned that you have to get an injection once every 7 to 10 days to, quote, keep it going. Is there a tolerance factor here? Are you seeing that in the research where over time that depression effect wanes because you're using it, too much?
Well, as I said, we're not using it in that way. We're using it in a course of psychotherapy. So the treatments we provide, it's an 8-week course of psychotherapy in which you take ketamine on 4 occasions over that 8 weeks, interspersed with non-drug psychotherapy sessions. Now, the doses and the pattern of dosing we use is highly unlikely to cause addiction. I think if you're using it more frequently, several times a week, that is more likely to cause addiction.
What about tolerance, though? Will the effect wane over time if you keep taking it, or do you have to take sort of a break after the 4 sessions and then come back at a later date if you need more therapy?
Yeah.
So tolerance is a factor of addiction. Tolerance can occur in different ways. It can be a pharmacological tolerance where you actually just need a higher dose to get the same effect, or you can get like a psychological tolerance, just in that you become more familiar with that space, so it can be perhaps less effective. We certainly don't see that within the dosing and patterns of dosing that we use in Awakn clinics. I think in some of the long-term infusion maintenance clinics, that would be a considerable risk, yeah.
Dr. Sessa, because psychedelics, narcotics, as they say with cannabis, they often get compared to like the same umbrella, so to speak. But, there's a lot more data that's proved to be monumental in the psychedelic industry. It makes it very different from cannabis. But when I see a lot of these ketamine clinics popping up, I can't help but feel that there's a lot of similarities to when CBD came onto the market 5-6 years ago and is going to be the next great medicine to help people with like anxiety and all this sort of stuff. But I have to ask, does ketamine in any way turn out to be another fad therapy similar to CBD, or is it complete opposite? And forgive me in advance if I'm asking a very uneducated type question.
No, I think it's a really good question, Shad, and it's a very important question. We have to be careful of fads in medicine, but ketamine or indeed other psychedelic therapies are very different, mainly because we're not using them in a daily maintenance fashion. Cannabis medicine, whether it's THC or CBD or both, you use it every day to mask your symptoms. So it's a bit like taking Prozac or an SSRI, any other SSRI. It doesn't really cure you of the problem. It just masks your symptoms. So you have to take it day in, day out for days, weeks, months, years, decades, and just stay on the drug to suppress the symptoms. That's kind of the basis behind cannabis medicine. And don't get me wrong, I'm a big fan of cannabis medicine. It's arguably safer and more effective than the traditional antidepressants we have, but it's still a daily maintenance medication. What we're aiming to do with ketamine-assisted psychedelic psychotherapy is to provide a course of psychotherapy with a few limited sessions of ketamine to work on the patient's core issues and problems and help to affect a lasting transformative change, which then translates into a change in their lifestyle and essentially overcoming the long-term mental health problems they've had, so they don't need to keep coming back again and again for the rest of their life. It's providing this breakthrough transformative experience. And we hear about this with psychedelics, don't we? We hear about people who go off to Peru and have ayahuasca once and suddenly they come back completely changed. I mean, we have to be careful of too much of that sort of messianic magic bullet, magic wand type approach with psychedelics. They're not necessarily going to provide us with that. They do with some people, but it's minimal. But it is really the antithesis of this biological medical model of taking a drug every day just to suppress symptoms. So going back to your question, Shad, no, there's big differences between the way we use ketamine and the way cannabis medicine is used.
Now Awakn is conducting a phase 3 clinical trial exploring the use of ketamine-assisted therapy for the treatment of alcohol use disorder, right? Obviously, that's a big accomplishment being in a phase 3 trial in itself. Are you a little surprised that perhaps, Awakn is not receiving perhaps the credit it deserves for being in such an advanced trial, which is really one of the most advanced in the whole psychedelic industry?
That's a good point.
Yeah, so we're very, very proud of this work. Professor Celia Morgan, who works near me in Exeter here in the UK, she carried out the phase 2B study using ketamine-assisted therapy and had tremendous results, 4 to 5 times better than the current best treatments for AUD using ketamine-assisted therapy. Awakn have acquired the data for that and own that material now, and we're now taking that study to phase 3. AUD is this incredibly difficult subject to treat. We were better at treating alcoholism 100 years ago in Victorian times than we are today. We're talking about 90% relapse rates at 12 months.
Why would it be better then, as opposed to now?
Well, because we had incredibly restrictive Victorian values like the temperance movement, that which I'm not suggesting is the right way of doing it, but just ironically, we were doing better back then. And, it's not like alcoholism is a rare condition. It affects 20% of the global population, 5% with a very severe dependence form. It's a huge, massive, multi-billion-dollar industry of care for AUD, yet the outcomes with traditional medicine are awful. I can't think of any other branch of medicine that would accept 90% poor outcomes with such a large prevalence public health problem. So AUD really is something that we need to treat. Now, this phase 3 study is fantastic because it's taking us towards licensing for AUD with ketamine-assisted therapy. Going back to your question, Ben, am I disappointed in why Awakn doesn't seem to be doing better? Well, the way I see it is we're in a kind of global market collapse all over. Everything is doing poorly at the moment. I think what we need to do is keep staying ahead of the pack. We are ahead of the pack in terms of our clinical and research experience. We have, bar none, the best scientific committees in the world who have the longest experience and the best scientific credentials. That will become recognized by the investors and markets, I'm quite certain. We need to just keep ahead of the pack, keep coming forward with innovative research, and when the investment picks up and the market picks up, I have no doubt that we're in absolutely the first place position to be global success in this market.
One of the things that
Yeah.
One of the things that impressed me, I was speaking to Peyton Nyquist, the CEO of Numinous Wellness, and he was out in California earlier this month at the JP Morgan Health Conference. Great conference to be at for biotech, probably one of the world's best. And what he's finding is that he's saying the same message to a lot of people at Goldman Sachs from a year ago. But now it's like these people, these bankers, these institutions are now really starting to understand what the industry presents, the pathway to revenue, and how it's potentially going to work. Do you find the people that you're speaking with, both from a scientific perspective, the people that are getting involved in the industry and learning for the first time, and we have conversations like we're doing this morning, are really starting to grasp and understand the idea more and more from, say, we were 6 months to a year ago?
I really do, because those of us that work in the field of addictions, we more than anyone know just how poor the current treatments are. You know, I've lost count of people with alcoholism that I've put through expensive 6-month inpatient rehabs that can cost £40,000-50,000. They go through the 6-month rehab and they walk out straight into the pub on the last day. I've lost count of the times I've thrown good money at bad treatments. Now, if we can demonstrate in an 8-week outpatient treatment for 1/10 of that price, better outcomes, then not only is this the right moral, ethical, and clinical thing to do, it's the right financial thing to do. We're throwing good money at bad with current treatments. And I think that regulatory authorities, public healthcare systems, insurance companies are starting to wake up to this. Psychedelics work. They're cheap, they're fast, they're clean, and they're successful, and they make financial sense. So what we're doing at the moment, we're opening clinics. We have 4 physical clinics, London, Bristol, Oslo, and Trondheim in Norway. We're opening more physical clinics in the UK and Europe. But the other thing we're doing that's very clever is we are licensing our treatments to other existing clinics, especially in Canada and North America. And we're working with beta test partners, Revitalist, Wellbeings, and Nishama. Now, this means not actually building physical Awakn clinics, which is an expensive capital thing to do, but licensing our treatments, particularly our care program treatment for alcohol use disorder. And what would happen as a licensed partner, they would come along, we would go and train their team, show them how to use our protocols, we would provide them with supervised practice and support, and then they would be providing Awakn care protocols for their AUD patients. And of course, there's many existing rehab and alcohol services in the States, or there's ketamine services that don't do ketamine psychotherapy. They just do infusions. And they want to learn how we do it, because we do it better than anyone else.
Gotcha.
And like you said, because we've got these studies, we can provide them with an evidence base for this treatment.
Okay, my last question over here, since you bring that up, and this is what I wanted to, I think our audience would like to know, are your services like the competitive advantage, right? Can they be replicated from other actors or other companies, and just to use ketamine and provide their own treatment and sort of copy what you're doing, and provide their own services and sort of cut what you do out, if that makes sense, from a competitive business strategy point of view? Yeah,
I mean, I guess what you're sort of saying is, how do you IP protect something like we're doing?
Exactly.
And the answer is, well, firstly, that's a complex field that I can't give you straight answers on. But what I would say is, you might think that people would do that, but actually people are not confident in doing this. And, you know, I've been working with psychedelics for 15, 20 years. I'm very confident with it. But there's a lot of people who just aren't. And they don't just want to pick it up and take up and copy what we're doing. They want us to help them to set it up. They want to use our experience and our expertise. So I think different versions of slightly similar protocols could emerge, but we're already there. And we're first of the pack with an evidence-based, out-of-the-box protocol ready to go that we can teach people. So I think that does give us a competitive edge. The other side of this is we're also carrying out innovative research in other directions. We're looking at different delivery models that will be patented and provide IP. So an oral thin film that will, an oral dispersible way of inducing ketamine and MDMA. These are our research platforms. So it's staying ahead of the pack in terms of this innovative research, in order for the company to show that it's at the front and leading. And that gives me a lot of confidence around the future financials for the company.
You know, we've seen, there's been a few interviews that featured ketamine clinics on NBC and CNBC recently. And I think we've seen a lot of those where people's lives are changed. I think at the stage now, what do you think is next for the next stage, next growth for the psychedelic industry?
Well, there's so many different directions in which it's growing. Some people are getting drugs over the line for approval, like MDMA and psilocybin. Others are building clinics. I think training psychedelic therapists is a very important part. We're in this strange position at the moment where in the next few years, when MDMA and psilocybin come online, we're suddenly going to need tens, if not hundreds of thousands of therapists all over the world. But at the moment, people generally have only really trained in these modalities if they've had research to do. So there's only a couple of hundred trained MDMA and psilocybin therapists in the world, and suddenly in 2 years we're going to need 60,000. So training psychedelic therapists is going to be a challenge for the future. Also, I think it's really important.
Can I stop you there? How do you get 60,000 licensed therapists ready to go in 2 years?
Well, that's the question, Chad. You tell me. With a lot of hard work and a lot of input. MAPS, the Multidisciplinary Association of Psychedelic Studies, are training people on large scale events, but of course that's only to deliver MDMA. Compass Pathway are training people, but that's only to deliver psilocybin. So, and there is a plethora new openings of psychedelic training centers, training therapists, but it's a lot of work. I think we're going to hit a bottleneck in a couple of years in terms of having enough therapists, even though the drugs will be available. The other challenges for the future, I think, are about getting this into public healthcare, because as I said, it makes economic sense. I didn't do this job just to provide psychedelics to rich people. I did this to treat large-scale, high-prevalence public health problems like AUD. Of course, which a lot of people don't have the money to pay for expensive healthcare.
Yeah,
now, I know it's very different in the UK compared to the States because you don't really have any kind of meaningful public healthcare system. But in the UK, we have the NHS. We need to be working with the NHS. Now, in an absolute landmark study, our AUD phase 3 study will be using 7 NHS sites, and it's 2/3 funded by the NHS. This is a huge step forward.
Yeah.
It's the first psychedelic study in the world to have NHS public healthcare funding like this. So it's a huge step forward for Awakn, and it really does put us at the front of the pack.
Growing, and growing. That's actually monumental when you think about it. Somebody like that to get involved. What's their take, I guess? Like, obviously the data is what's telling, right?
I think their take is, like I said, we know that the current treatments for alcohol use disorder and most other mental health problems are poor, but still expensive. There's one thing I often say in my talks: there's nothing more expensive than the untreated psychiatric patient. They cost millions over a lifetime. They don't work, they're on disability benefits, they offend, they go to prison, they need new legs, they need new livers, social services become involved, you have poverty and transgenerational lack of care, all of these things tied up with untreated mental health care. So you're cutting corners, and it's false economy to not adequately treat mental disorder, particularly addictions. And I think organizations like the NHS or insurance companies are waking up to this. It's not that they're not spending money on these people, they're just spending the wrong amount of money on the wrong sort of treatments. So, as I said, psychedelics make moral, ethical, and clinical sense, but they also make absolute financial sense, which suddenly means this market of mental health care is up for grabs with psychedelics.
Well,
and I don't say that in a corporate way. I say that as a medical doctor who wants to see safe, effective, cheap, available treatments to everyone. Now, it's not, for those investors out there that are thinking, well, we're going to spend and buy our way out of a job here. We will always have mental disorder. That's not going away. There are plenty of customers, queues around the blocks for this. The market is huge. What we need is companies that can provide safe, effective, evidence-based, ethical care to patients. And that's what we aim to do at Awakn Life Sciences.
Well said.
Well said. I can tell you firsthand, the insurance companies are fed up with trying to cover all these drugs that just don't work, because every single time it's just like a patient is back to square one. And some of the conversations I've had with other people on these podcasts have had these conversations with these insurance companies and have stated, whether it's ketamine related, like, do the research, let's see the data. We need to start finding other solutions because we're tired of just prescribing and covering all these, plans that is a drug that, more importantly, doesn't work right now. It's not working.
Yeah, and it's not just the drugs. It's like, for example, the most expensive thing in mental health care is an inpatient admission. As soon as you go into psychiatric hospital, it's £9,000-10,000 a week to go to psychiatric hospital. So if you don't treat the patient adequately in the first place, and you cut corners and don't provide the right kind of psychotherapy, etc., and they end up going into hospital, all the savings you've made are just suddenly lost like that. So if you think about it, our treatment, and the figures are in sterling pounds, I'm afraid. So it's £5,000 for the 8-week outpatient treatment at Awakn. Sounds like a lot of money. It is a lot of money. But actually, if that gets your patient better, and they don't have to go to hospital, they don't have to have another detox, they don't have to have rehab.
Exactly.
You're saving millions over a patient's lifetime.
Yeah.
So I do think that the world, the public healthcare systems, and the financial systems and insurance companies are waking up to this, that this works. This is going to be a much better way to do psychiatry.
Great feedback. I got to admit, that segment in How to Change Your Mind, what was that, the late 80s, early 90s rave scene in the UK?
Yeah, late 80s, early 90s when I was a DJ, and that's where I came across MDMA. And, I didn't know it then, but I could then when I went to med school and then trained and started working in psychiatry, and then started seeing the lack of efficacy of the current treatments.
Right.
And especially seeing the way so many disorders, whether it's depression, anxiety, PTSD, addictions, are linked to trauma, childhood trauma. I worked with abused children for 10, 15 years. And then seeing the lack of efficacy and the sheer expense of poorly delivered mental health care, it just became clear that what psychiatry needs is a new innovative technology. And what psychedelics do is they disrupt that stuckness, that narrative that comes from early trauma. They disrupt it in a way that the other drugs like SSRIs don't. SSRIs just paper over the cracks and keep you ticking along. Psychedelics disrupt that issue. It's a new technology. It's all about what we call neuroadaptation, neuroflexibility, neuroplasticity. We're seeing it with psilocybin, with a disruption of the default mode network. We're seeing it with MDMA, with the switching off of the amygdala. And we're seeing it with ketamine, with neuroplasticity due to new protein growth and new dendritic growth. So these are a radically new way of looking at brain chemistry. And then you combine that with psychotherapy. So the drugs really act as a primer. They put the brain into a new physical state, and then you hit them with the psychotherapy during that window of opportunity, and you have this opportunity to radically shift ways of thinking and introduce new ways of thinking and new opportunities. And whether it's ketamine, MDMA, or psilocybin, they all work differently, different biological mechanisms, different subjective psychological effects, but they all, in similar, open this window of opportunity, which provides you with this chance to use psychotherapy to shift the patient. And that gets the patient out of this stuck rut that they've been stuck in since childhood.
Does psychedelics upend the healthcare system and the pharmaceutical industry?
Well, I think that's up to the healthcare system and the pharmaceutical industry to stand up and learn to adapt to this. I'm not here to upend anything. I'm here to get the best treatments for my patients. I do think that we need to have a new way of doing it. The way the pharma system works at the moment and the way the classification system of diagnoses works is you have to have a specific set of symptoms that is for a specific diagnosis, and then you have a specific drug to treat that. Now, psychedelics kind of blow that all open because whether it's MDMA, ketamine, or psilocybin, they kind of work for all conditions because they enhance psychotherapy. So we're going to have a whole new way of looking at how we structure the pharma industry and the use of psychedelics. And that's what we're doing at Awakn Life Sciences. We're really broadening the net in terms of looking at different conditions. I mean, another piece of interesting work that we're doing at the moment is we're looking at behavioral addictions. Now, behavioral addictions are a hugely prevalent problem that is very much under the radar. So this is gambling disorder, sex disorder, binge eating disorder, gaming disorder, internet and pornography addiction. These things are much more prevalent than we give them credit for. And there's no decent treatments for these.
Yeah.
Now, we believe that ketamine-assisted psychedelic therapy, delivered with this new oral thin film effect, which is rapid acting and easier to administer, we've started doing the research on this now. And that's very much part of our R&D pipeline for coming years.
A DJ, huh? You must have met some pretty cool people in your day.
I've met pretty much all the cool people.
Ben here, he was talking before we started the podcast. He was big in the DJ days, named some pretty big name people. What were some of the names you were saying, Ben?
Oh, well, I mean, there were...
Go ahead. Yeah, the UK DJs were some of the best in the world. Pete Tong, Paul Oakenfold, Nick Warren, if you're into trance. And of course, you have all the great venues like, Creamfields and all the, the good outside, raves, if you want to call it.
Yeah, and also the city where I'm from here, Bristol, is cool. This is what we call the San Francisco of the UK. Bands like Massive Attack.
Portishead.
Tricky.
Portishead. I love Portishead.
The birth of jungle came out of Bristol, so this is the coolest city, and it's always been a very innovative place, a place for liberal, free thinkers, but it's also got a lot of scientific credibility and kudos, a great university. So yeah, we think we're really well placed to do this. I'm really proud of my early roots in the rave scene. What I've spent my whole life trying to do, though, you see, Shad and Ben, is to find a language to bring this to the general public and the mainstream. You know, the way I see it is the hippies have had 75 years to do this.
Yeah, good point.
Since the birth of LSD. And where are we? We haven't got anywhere. Some people object to what they call corporatization or medicalization of psychedelics. I don't object to it. I call this increased accessibility. These drugs are too good to stay in raves and parties. These drugs deserve to be in doctors' cabinets, being delivered by approved, licensed, regulated outlets with expert scientific credibility. There is a huge population of patients who can benefit from this. So what we're doing is I'm trying to find the language to turn these interesting, fun party drugs into proper approved medicines so we can bring this to the masses and we can really make a dent on this massive epidemic of psychiatric problems.
And a quick point here, everybody associates the party scene, electronic music party scene, with MDMA, and of course that was very prevalent, but ketamine was also very prevalent in that scene as well, right? Maybe to a lesser degree, but it was still widely circulated, was it not?
Well, it still is, and don't get me wrong, I'm not playing down the risks of recreational ketamine. Recreational ketamine use, when it's heavy and it's unregulated, does cause problems. Certainly even here in Bristol, we're seeing problems with recreational ketamine addiction, and it causes some pretty physical symptoms of bladder dysfunction when used in very high repeated doses. As I said, we don't see those problems in the dosing and the pattern of dosing that we use in our clinics. But yeah, these drugs are associated with recreational use. Now, that doesn't mean that they're not useful. And I think the other debate that we haven't talked about is prohibition and the war on drugs. That's coming to an end, thankfully, after 50 years. I mean, I would say that this prohibition and war on drugs is the greatest socio-political folly of the last 50 years. And we'll look back and hang our heads in shame at, locking people up for this. It's like, if drugs are dangerous, then they need to be regulated, not banned.
Portugal really opened up a lot of people's eyes, did it not?
Yeah, absolutely. I mean, if you ban something, it doesn't go away. All that's happened is we've handed the franchise to the mafia to distribute and supply the drugs. Drug use is popular and common. We need to have regulatory systems and drug policy systems that make it safer and ironically, use is increased when you have a more prohibitive system. Now, we're seeing changes all over the world, particularly in the States with the cannabis industry and in Canada. We have a pretty poor drug policy system in the UK, and it hampers research. But we are moving forward. I think the war on drugs is in its dying days. We need much more progressive, evidence-based, scientific-run processes to manage drugs. And certainly we need to get these drugs as licensed medicines so we can start using them for these worthy, needy patients.
Yeah. Well, this is why we do what we do, have conversations with you where we want to talk to people and understand what the past is, but also the business side and what this industry is going to be moving forward. But it's great, the platforms the people that we get to meet every day and people like yourselves that educate us on this. But I applaud, obviously, the initiative that you're doing, and keep up the great work, and let's keep in touch.
And I would say the same to you, Shad, and to you, Ben. Nice to see you again today. Thank you for all the work you're doing, and shining the light on the markets around psychedelics. We really want to see this become mainstream, wide-scale, global mental health care, and that requires markets to sit up and take notice. So thank you for promoting Awakn in the way you do. We're quite convinced we are the best in the world. I mean, I know I'm biased, but actually this is based on the expertise and the experience we have. So we're really feeling positive about the future.
Well said. All right, Dr. Sessa, keep in touch. Or should I call you DJ Dr. Sessa?
Dr. Ben Love. That's what I was called. Dr. Ben Love when I was DJ.
Dr. Ben Love. I like that. All right. Good seeing you.
Okay. You take it steady.
Take care. Hey, everyone. Thanks for watching. 2023 is here. And right now, a lot of uncertainty pertaining to the markets, especially new emerging industries like crypto, cannabis, psychedelics, and more. So leave a comment below and let us know who you want us to interview. What are the questions that you want asked? And most importantly, what's the information that you want to learn? Once we produce these videos, then share this to your network, subscribe to our channel, and click on that bell for all notifications because we would not be here without you. Thanks for watching, everyone.